is Brenda Mahan. I'm the Clinical Education Manager at BRODA. BRODA began in 1981 with the radical idea that seating in healthcare needs to be more comfortable. And here we are over 40 years later, providing our customers with comfort, safety, and mobility.
Hello, I'm Alicia Jenkins. I'm the Director of Clinical Services and Provider Markets with CoreStrata. And CoreStrata exists because providers often lack access to board-certified wound and ostomy nurses. We're a telehealth solution that provides virtual access to board-certified wound and ostomy nurses in all 50 states to support providers with evidence-based care.
So now we're going to discuss risk factors for pressure injuries. Some risk factors for pressure injuries to consider for people who spend several hours a day either in bed or seated in a wheelchair include people with suboptimal nutrition, anyone experiencing weight loss, people with a diagnosis of heart disease, impaired circulation, decreased sensation, poor hygiene, anyone utilizing improperly fit or improper equipment. And another consideration includes wheelchair users that have limited mobility may not be able to perform an effective weight shift.
Best practices to prevent pressure injuries begins with a thorough head-to-toe skin assessment at admission and regular intervals per facility protocols, as well as with any change in patient condition. Looking at all skin with special emphasis on bony prominences and under medical devices. A pressure injury prevention program needs to address when and how often this is completed, and documentation needs to support recording of the skin assessment. Next, choose and use a pressure injury risk assessment tool. For example, the BRODA. Again, determine when and how often this is to be completed. Frequency is often regulated by the patient care setting, for example, critical care versus long-term care, and address each subcategory of the BRODA and develop a plan of action to address those specific risk areas, whether moisture, friction or shear, mobility, nutrition, sensory perception, or activity. Develop and modify that care plan with any change in patient assessment. Nutritional status, if a risk is identified, again, develop a plan, including the dietitian to address concerns, especially in individuals with complicating comorbidities. Assessment of mobility and repositioning. Physical therapists and occupational therapists are vital to address challenges and ensure patient has all needed and appropriate equipment that's individualized to the patient's specific needs. Support surfaces, we think of wheelchair cushions and mattress overlayer replacements, and these items are often covered based on patient assessment and/or care setting. It's important to identify which surfaces are needed and implement pressure redistribution immediately for those at risk.
Pressure injury prevention interventions. Comfort should always be important and should always be a top consideration. When we talk about microclimate, it includes any areas of the body that are in contact with either the mattress or the seating surface, especially the areas under the bony prominences where a significant buildup of moisture or heat can occur. We can reduce microclimate by choosing surface covers that are vapor permeable or breathable, if you will, for mattresses and for cushions. As in any treatment, the patient's goals should always be the top priority. We want to enlist assistance from the team to determine the best equipment, and therapy should always be consulted for wheelchair seating and positioning concerns. Surface pressure redistribution properties to look for either in an overlay for a mattress or for a wheelchair cushion include immersion. So it's a surface that actually allows the body to sink in. Or we can look for envelopment. It allows the body to sink in and conform to the client's shape. And then, of course, offloading, removing the pressure from a small area and loading it onto a larger surface area. For instance, a wheelchair cushion that has a sacral cutout actually transfers the pressure from the sacrum to the greater trochanters or down the femur instead, where the surface area is greater. Or you can use a tilt and recline seating system to offload and redistribute pressure.
Common points of pressure while laying are seen here, and options for pressure redistribution vary in type and components. Group 1 surfaces, for instance, may contain gel, foam, or alternating air pressure, or Group 2 low air loss mattresses. Choice and coverage depends on patient and wound assessment needs, mobility activity, microclimate, and shear reduction needs. Mattress overlays do not negate the need to specifically address head or heels, which require additional attention for offloading. For instance, heel suspension boots or floating of heels is still needed. As well, unless contraindicated, all individuals at risk of or who have pressure injury should be repositioned on an individualized schedule. Repositioning is still necessary to improve pressure relief and pain control. Avoid positioning on hips, instead using 30-degree tilts from side to side and small shifts using pillows between knees.
In my experience over the years working as an occupational therapist, the most common pressure injury area for wheelchair users is typically the sacrum and the ischial tuberosities. A wound can occur anywhere, and it can occur lying in bed as well. So we always want to be mindful of addressing that while the patient, and regardless of where the wound came from, we want to be mindful when addressing this with seating and positioning. A jerry chair is basically a piece of inexpensive furniture. It's poorly designed. It really does not provide any postural support. It limits a person's ability to engage in activities and places the person at a higher risk for shear since it only reclines. Shear is insidious, it's silent, and it's sneaky. Unlike a pressure injury that can occur over a little span of time with some indicators that it's going to happen, shear happens in a matter of seconds. It occurs when the pelvis or the spine begins to move inside the skin. Unfortunately, shear is doing its damage quietly in the background, and by the time we see the damage, it's already gone through all the skin layers. Pressure injury prevention in wheelchairs. When someone's sitting in a wheelchair that doesn't fit them properly, it will increase the peak pressures underneath the bony prominences, which puts a constant compressive force on the skin and the soft tissue. This continuous downward pressure occurs, especially when a patient is seated in a poor postural alignment, such as slumping, sliding, or leaning, or if they're sitting in a chair that's too big or too small. So what can be done through seating and positioning? We want to provide a seating system that fits the user's measurements and their contours, that provides good pressure redistribution. If the pressure on the bony prominences is not redistributed, a pressure injury will occur and will continue to occur until the pressure is redistributed. Tilt and recline are valuable tools to redistribute pressure away from ischial tuberosities. The literature shows that slight tilt and recline position changes can reduce sitting interfaces and sitting interface pressures. However, changes in ischial blood flow only occur at larger angles. According to the newest guidelines from the Paralyzed Veterans of America, tilt and recline should occur every 15 to 30 minutes, and a person should remain in tilt and recline for approximately a minute. Optimal pressure relief occurs between 25 to 35 degrees of tilt and 120 degrees of recline.
Let's take a look at our patient's story. We had a 37-year-old male with a complex medical history with Pickwickian syndrome, diabetes type 2, severe intellectual disability, poor mobility, and incontinence of bowel and bladder. The patient developed a pressure injury in March, was hospitalized in April for 2 weeks for IV antibiotics for osteomyelitis, had debridement and negative pressure wound therapy, was then transferred to a skilled nurse facility and discharged home then to the care of the mother and in-home caregiver in home health 3 times weekly. Has also been transported to an outpatient wound center, and we received the referral in July. And we asked for the patient's images to be sent to us of the wound, as well as what pressure relief modalities he had in the home. And what we noted were implications that show that there was not good coordination between providers, and there was no pressure injury prevention in place from a hospital bed to wheelchair standpoint, the equipment needs. And the wound could have been avoided with evidence-based prevention interventions. Items we addressed to help this patient with all the areas of the brain that this patient was specifically at risk for included diet, nutrition. We recommended supplementation, and the patient was drinking a protein supplement drink 2 times daily like Juven. Incontinence, wound dressing options were based on the ability to maintain the dressings. In the patient's limited mobility, he was bedbound with a limited time up to wheelchair, had impaired cognition, which affects reporting for repositioning or offloading, and then had inappropriate equipment. So we recommended a BRODA chair and a group 2 low air loss mattress. Next, let's take a look at those images. So it really paints the picture of this patient and why those were our items that we knew needed to be addressed. So you see the stage 4 pressure injury. And then the equipment. The wheelchair was obviously a straight back wheelchair without any wheelchair cushion to assist with offloading when he was up to the wheelchair. And this gentleman really needed a custom wheelchair because of his size and immobility. And then the hospital bed was a plain bed with a plain hospital mattress, and he really required the group 2 low air loss to support both prevention of developing new pressure injuries as well as healing of this current pressure injury. Key takeaways: pressure injury prevention and wound care is a team effort. You want to be sure you're including all members of the care team that are needed to address the patient's specific risk factors and needs, especially the dietitian, the nurse, physical therapist, occupational therapist. Depending on what that risk factor was, be sure you're including that needed team member.
We must address the cause of the pressure injury and provide equipment that will redistribute or offload the pressure to promote healing and prevent the injury from worsening. Pressure injury prevention is important at all stages of life.
We want to thank you for joining us and hope you have received some valuable information today.
Thank you for your attention, and I hope you found some information regarding seating and positioning that can help you in the future.